Well, thank you so much for joining us. I'll just kind of go on for the followers and just give like a quick little introduction because this is our second time doing a live. So I'm sure at this point a lot of people are now familiar with you. But you've just been an icon in the professional skincare market for about 40 years now. And the medical community has recognized you for your innovative technologies. You have numerous patents. New Beauty Magazine loves you, as do we. So you've been top 20 innovators in the aesthetic space, and you've spoken at numerous medical conferences around the world. So you're very qualified to talk about rosacea today.
Well,
um,
thank you so much. Yeah. One thing I want to mention too, New Beauty Magazine, for those of you who may not be real familiar with it, New Beauty Magazine is the #1 publication in its space. It comes out quarterly and it's a big, thick publication, and it has everything that somebody wants to know about any kind of medical procedure, as well as products. And it's just great because it just keeps you up to date on all these things that people want to know about, you know, what procedures and things that they can do. And it also has recommendations of physicians and things like that. But anyway, the interesting thing about New Beauty is that its editorial board pretty much is physicians. It's peer reviewed. So you don't find things in there in articles that haven't been medically validated. And every year they vote on products. And so for 13 years in a row, we have been voted the best skincare management system.
yeah, that's incredible. And we love results and we love medical grade skincare. So we're here for it.
Yeah.
um, Okay, so I guess I'll just like start jumping into the questions. And I did let everyone know that it's okay for them to ask questions as
Oh,
well.
absolutely. I'd love to get questions. It doesn't have to be just on rosacea, but that is our topic today. So any questions anybody wants to ask.
Okay, awesome. Thank you so much for taking your time to do this too. So I guess we'll jump into the first one. What would you say the stats on rosacea are and who gets rosacea?
Well, yeah, that's a great starting question because it does affect over 16 million Americans, and I'll tell you that's actually a low number. Because unless somebody goes to a physician, somehow it has to get reported to be a statistic. And there's just so many people that have rosacea, as you know, that have never been to a physician. So we know it's far greater than that. It's one of the fastest growing skincare diseases. The numbers are just underreported. And a lot of people just think that their skin is red or that they have rosacea. And you can have rosacea and you can have acne at the same time. So sometimes people think, well, I have acne. I don't have, they're not even sure what rosacea is. They can actually be there at the same time, although they're two different disorders. And so it is something that we really want to focus on because it concerns so many different people.
It really does. So who would you say is getting the most rosacea, or what's the demographic
Yeah.
for?
Well, okay. So, first of all, what exactly is rosacea? Now, it used to be called acne rosacea,
Okay.
but actually that's an incorrect term because acne and rosacea are two separate diseases, but they do have some overlap. And they're both inflammatory disorders and they can be present at the same time. Now, typically, you're going to see rosacea, the onset between the ages of 30 and 50. Now, can you see it at a younger age? Yes. And actually, I've had a case study years ago that somebody was 23 years old. So you can see it at younger ages, but in general, it's between 30 and 50. And of course, somebody can get it when they're 60 or when they're 70 as well. And it is more prevalent in females. Now, males do get rosacea. When they get rosacea, though, oftentimes it progresses more rapidly and they may have a more aggressive case of rosacea. We don't know why exactly. And usually it's going to be in fair-skinned individuals. Now, can Asians get rosacea? Can Hispanics get rosacea? Even fair-skinned Black individuals, can they get rosacea? Absolutely. But in general, you're going to see it's much more prevalent in fair-skinned individuals. And a lot of times people will say, well, is rosacea genetic? Well, you inherit your fair skin. So it's genetic from that standpoint. I don't believe there's a rosacea gene because a lot of issues having to do with rosacea have to do with you have fair skin, and it has to do with sun exposure and some other kinds of issues. But in general, if somebody has rosacea, when we talk about the characteristics of rosacea, usually how we spot it is its redness.
Yeah.
But the actual sort of definition of rosacea is that it's a chronic inflammatory disorder, and it is a disease of vasomotor instability. So your blood vessels are designed to expand, they're designed to contract, expand and contract. And in rosacea, the blood vessels are compromised. They've lost their ability to expand and contract. So that's kind of one of the common characteristics, is that we see redness and we see something called telangiectasia.
Yeah.
Now, telangiectasia are those dilated capillaries. Technically, they're not broken. If they're broken, you wouldn't be able to see them.
Okay.
But they're dilated. And again, they're unstable. Sometimes people will say, well, gee, my skin is red at certain times. Other times it's not red. Some people flush and blush. They're red all the time. So it has to do with this instability, and it can be different in different people. Also, one of the things that nobody wants to hear, there's no cure for rosacea.
I know.
We can manage it, but there's no cure for it. It's not like, okay, gee, my skin is better, I don't need to treat it any longer. There's no cure for acne. There's no cure for rosacea. There's no cure at present for aging, but we can manage these kinds of things. We can manage the appearance of them significantly. No cure for discoloration. We can manage it.
Yeah.
So that's kind of, where we're at in terms of being able to manage it. And so here's kind of the common characteristics of rosacea, just so everybody's on the same page. So there's something that called pre-stage 1 rosacea. That's something I sort of came up with. And we see this in individuals. They could be teenagers or they could be young adults. And when they get really excited, or when they have a glass of some kind of alcohol or spicy food, they flush and they blush, and it kind of goes down this way. But oftentimes it may be just for a couple of minutes, or it could be 10 minutes, but it goes away. Then their skin is fine. Now, what they're showing signs of this instability. And does that mean they're absolutely going to get rosacea? Well, it means they're probably predisposed to it because maybe they've had a lot of sun exposure.
Yeah.
But it also is an indication that they can do things to kind of help to prevent the onset of rosacea. And then we go into the next stage, and that's when you actually have rosacea. Now, rosacea is generally talked about in either stages or subtypes. And so this would kind of be like subtype 1 rosacea. Now, that is generally where there is redness, and there's starting to be the telangiectasia, and the telangiectasia is going to be there whether you're red or not. So you look at the skin and you can see these blood vessels that are present. But the redness can kind of come and go. It can be transient. So you could be red for hours at a time. You could be red for days at a time. You could have periods of time where you're not red. And there's things that could actually aggravate that redness, and you could be more red than you normally would be. Now, when you hit the next stage of rosacea, the next stage is where the redness is persistent. So there's some degree of redness all the time. Maybe your cheeks are red all the time. In addition, there can be papules and there can be pustules. Now, the papules and pustules usually are going to be through here. And they need to be treated because they can leave shallow scars.
Yeah.
Now, what's the difference between something like that and acne? Because it can look just like acne.
It does. And I have a lot of clients that come in and they think that they're coming in for acne, but it's actually rosacea. This is so common.
Well, so one of the distinguishing characteristics is that generally the rosacea lesions are transient. Now, what I mean by that is you could wake up and you could have rosacea lesions and then they can kind of disappear. Or you could go to bed with rosacea lesions and they might not be there in the morning.
Yeah.
we wish that would happen with acne.
No.
But here's the difference. The only way that you can have acne is if it starts off in the follicle with what's called a microcomedone. Those are when cells stick together. So that's the only way, and acne progresses from there.
Yeah.
If you were to biopsy a rosacea lesion, there's no microcomedone. It's strictly inflammatory. They're shallow. So they're not as deep as acne, but you can still get minor scarring. So again, there's no microcomedone. It's strictly inflammation. And so what happens when you get into that next stage, it can be papules, it can be pustules, and there's more prominent sebaceous glands. Now, that doesn't necessarily mean you're producing more oil, but the sebaceous glands, I'm sure you've seen this, the skin can kind of start to look sort of orange peel or can look coarser. And by the way, another interesting thing about rosacea is it doesn't progress evenly. Some people start off with stage 2. Some people stay in stage 1 literally indefinitely.
Oh, wow.
So you can start off with a much more aggressive form of rosacea. Now, if you're in stage 3 or subtype 3, you get large inflammatory nodules. So you can get big nodules that can look like acne.
Yeah.
And again, the skin gets more orange peel-like. And also there's a continued enlargement of the sebaceous glands. And there's a couple of exotic forms of rosacea that we won't really talk about, but they're still in the rosacea category, Rosacea conglobulata and Rosacea fulminans. And Rosacea fulminans gets its name because literally it's the most horrendous. It looks like somebody has the most severe acne you've ever seen, and it can happen in a matter of days.
That's
No,
horrible.
no rosacea, and then in a matter of days. And Rosacea conglobulata is another really aggressive form of rosacea is very large lesions. Those are treated, virtually the only way you can treat them is with Accutane.
Yeah.
So, but we won't get into that. That's a much more exotic form of rosacea. Now, what causes rosacea? So the number one causative factor is sun exposure. And it doesn't mean that you were this dedicated sunbather. You
Yeah.
may have been a sunbather, but it's incidental sun exposure. It's sun exposure from the time, if you've got fair skin and your skin is much more vulnerable to the sun, it's sun exposure from the time, before the age of 10.
Yeah.
And just being outdoors and playing outdoors if you weren't wearing a sunscreen. But I'm going to say the majority of people at some point in their life, they may have been a sunbather. They may have done tanning beds. And that's going to be your number one causative factor. And what happens is the UV light has in the way that it affects everybody this way, but fair skinned people are much more vulnerable. That UV light affects the vascular structure, causes passive dilation, it causes a lot of other problems. But beyond sun exposure, one of the other things that becomes compromised, and this is the number one factor in rosacea, is called the kisilicidin protein.
Yes.
Now,
I
the kisilicidin protein is an inflammatory protein. So we all produce it, and it's actually a good protein because it's one of the factors that our body produces for wound healing.
Okay.
So one of the reasons why, you get some inflammation and redness with a wound is because it's part of the healing process.
Yeah.
What happens in people with rosacea is they produce this protein for no reason.
Okay.
So they produce it when they have certain triggers. Now, for example, sun would be a trigger, but there's a lot of other triggers that are going to cause this protein to be produced. For example,
Yes.
alcohol, spicy food,
Yep.
so maybe food that's too hot, sometimes caffeine. A big trigger is sugar, and it can be different for different people. There are some people that react with berries, exercise,
Yeah.
sitting in a really stuffy room. not getting enough sleep. There's all these different things. You know, allergies can be a trigger for some people. So it can be different things for different people. But this is the key factor. Rosacea is not a disease of sensitivity. Everybody says, oh yeah, I have rosacea, my skin is sensitive. You could have really sensitive skin and not have rosacea. And you
Yeah.
can have rosacea and not be sensitive. You're reactive. That's the key. It's reactivity.
Yeah.
It's not about being reactive to products. Now you could be,
Yeah.
but
Yeah.
rosacea is not specifically related to, oh, gee, I'm reactive. I can't use a retinoid. I can't use glycolic. No, those are things you should be using. So it's a disease of reactivity, not sensitivity. And what we have to do is we have to downregulate that inflammatory pathway and all the inflammatory pathways.
Yeah.
And the other thing that's really, really hard is you've got to manage your lifestyle.
Yeah. That's the hardest part with clients, like getting through to them about
Mm-hmm.
managing style. But I will say also, to kind of circle back really quick, you saying that it's about reactivity and not sensitivity, I have heard you say that before, and that's really pushed me in the treatment room because that like sits in the back of my mind and I'm like, okay, they're reactive, they're not sensitive, and I really have to say that I've like pushed their skin a little bit further, and that's really helped me get better results.
It's just a mindset, and I understand that because when you see redness and you see that kind of reactivity, you think, "Oh, I'm sensitive."
Yeah.
It's an automatic. I mean, it makes sense. Why wouldn't you think that? But what happens is people gravitate to so-called sensitive skin products in which
Yes.
oftentimes they're more sensitive to or more reactive to. For example, botanicals or things that um, just are not agreeable, and it doesn't help with the disease itself. And so there are things that you can do that manages it that can make a huge difference. But reason lifestyle is so difficult is because, you know, if you enjoy a glass of wine. I had a sister-in-law that white wine, no problem, but she didn't like white wine. She liked red wine. Red wine was one of her triggers. You know, you like spicy food.
Yeah.
Um, you like sugar. You know, you want to have a dessert. Or like me, at one time I was just an absolute chocoholic, candyholic, and those kinds of things can be really significant triggers. And a lot of people don't even realize that because
Yeah.
they just assume that their skin is going to be red most or all of the time.
Yeah. I have a client who, I mean, who doesn't love baked goods, but we always talk about it because she'll come in and she'll be like, I know, I had a couple baked goods over the weekend, and I'm like, it's okay, as long as you know, then it's fine.
And,
Um, yeah,
and the other thing that is really people have to understand is that lots of times you're not looking at the food as being, oh, that has a lot of sugar in it.
yeah,
But there's something called the glycemic load, and that has to do with carbs, and carbs turn into glucose, and they will turn into more glucose than if you actually ate sugar, a lot of carbs. So maybe you're having a lot of pasta or you're having bread or things like that. And it's really about keeping that glycemic load down really, really low because sugar is an inflammatory.
yeah,
And when your glucose, when it turns into glucose, it sticks to every cell in your body. And it
yeah,
ages the skin tremendously because it sticks to your collagen. And it causes it to decrease, it causes it to harden, fibrose. Sugar is a really huge, huge trigger in this respect.
yeah.
Um, okay.
Okay, so would you say climate and weather can influence your rosacea?
Absolutely. So it's again different for different people. Sometimes it's when it's really cold. Other times for people, it's really hot or it's humidity, but it's not the same for everyone. And I was diagnosed actually when I was 25 with mild rosacea. Now, it's completely managed. You can look as close as you can. I'm also a 2-time Accutane failure. So I never break out. If I didn't do what I do, I would have a problem. But, you know, for me, it was if I would sit in a stuffy room, I could feel my face start to get hot. So I don't know what it is, maybe not having enough circulation, temperature being just a little bit off, who knows? But that was one of my triggers. So it's different for different people, but absolutely weather can be a trigger. So I know everyone's wondering, okay, so what do you do for
Yeah.
rosacea, right?
What's the solution?
Okay, what's the solution? Now, I always say you can do whatever you want, but there's really no negotiation, no exceptions, because there's certain things that you have to do in order to be able to manage rosacea. Oh, and by the way, before we get to that, I want to just talk for a second about something that a lot of people have been sort of, there's a misconception because a lot of people think it has to do with the Demodex mite.
Yes, that is such a popular topic.
Let's spend a second on that
Okay.
because the Demodex mite is something we all have. It's in our body, every one of us. It doesn't matter whether we have rosacea or not. And you're supposed to have, it's for every centimeter of skin. And these, by the way, these mites are so tiny, you'd need a microscope literally to see them because you could put a gazillion of them on the head of a pin. And
Oh, wow.
there's just a few of them per centimeter of skin. Now, what happens with the Demodex mite is that it lives for about 2 weeks. And when it dies, it gives off a toxin.
Okay.
So it's this kind of inflammatory toxin. Now, if the Demodex mite were an issue, we would all have rosacea because we would all be reactive to this toxin.
Yeah.
And what they've done with rosacea patients, they've actually biopsied follicles, and sometimes people with severe rosacea hardly have any Demodex mites in their follicles at all. Other times, people that have very mild rosacea have lots of Demodex mites. So they've never been able to exactly tie the two in with what we'll call run-of-the-mill rosacea. Okay? Now, there's something called Demodex dermatitis and Demodex rosacea. That's different. And hopefully, if you see somebody like that, you just get them to a derm right away because it looks like somebody threw tomato sauce on their face.
Oh, wow.
I mean, it's really red, it's really inflamed. And what they're doing is they're reacting to this toxin. And for them, they have to use something that's actually an antifungal called crotamycin or what was the other one? Ivermectin.
Oh, okay.
And and these are literally insecticides.
Oh, wow.
And that generally works really well for them because you're literally killing the Demodex mite that is causing this toxicity.
Yeah.
So that's a whole different thing. So what we're talking about kind of is run-of-the-mill rosacea, which is the majority of the population. Now, okay, so how do you treat it? Well, first of all, number one, it starts off with the skin care management system. Okay,
Yeah.
that's the basic system. Everyone starts off with the system. So I could be talking with a world famous physician, I could be talking with an A-list celebrity, it doesn't matter, everybody. And the question is always, well, how can we all be on the same system and have different concerns? Well, I'll just mention one product, BioClear. So you know where I'm going with this.
Love
Okay, BioClear is glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for rosacea.
Yes.
It's also one of the best resurfacing agents we've seen for the appearance of fine lines and wrinkles. It's also sold by prescription for acne, and it's a pigment lifting agent. And you know, if you have rosacea, doesn't mean you don't have fine lines and wrinkles. Doesn't mean you don't have textural problems. Doesn't mean you don't have acne. So glycolic acid, which is also in BioClear, glycolic acid is at the very simplest level. It dissolves and dislodges the glue-like substance or cellular cement between cells. So it causes them to lift apart. So it resurfaces the skin, and it does this without being abrasive. Now, the one thing you never want to do on rosacea is you never want to do scrubs, ever, 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 because that is inflammatory.
Yeah.
But glycolic is an anti-inflammatory. And as a matter of fact, it's one of the primary tools in many physicians' arsenals for rosacea. And also, there's a study by two different female physicians who each head up the Department of Dermatology at two different universities. What they did is they took a group of patients and they started them off on 20% glycolic acid home care. That's very
That
aggressive.
is,
In
yeah.
2 weeks, they started doing glycolic acid peels.
That's
Just 2 weeks.
yeah.
And in every single case, there was a lessening of redness. There was a lessening in the appearance of telangiectasia. They were able to completely eradicate and control secondary lesions, the papules and pustules, and they were able to halt the progression of the disease.
That's amazing. That is really cool. And I believe it because I had tried all different things to treat my rosacea just because like, you open a skincare account, you start like learning about all their products, and then I had wanted to switch over to Jan Marini, and then I did, and finally I just had this like lingering redness that I thought maybe could it be like that lupus mylar butterfly
Uh-huh.
rash. And I mean BioClear was just like, hold on, I'm gonna take care of it almost immediately, and it just like wiped, like, look red at all. And
It's a very powerful anti-inflammatory, and it has such a small molecule, it goes into the follicle. And when it gets into the follicle, it dissolves and dislodges the glue-like substance or cellular cement with that has to do with the cells sticking together, so it interrupts the acne process.
which is amazing. I always tell my clients, you want glass skin, you talk about glass skin all the
Mm-hmm.
time. BioClear is like chef's kiss.
Exactly. And it's really fast.
So,
And it also has an amazing effect on the appearance of fine lines and wrinkles, and it thickens the dermis up to about by 33%. You want really thin stratum corneum.
yeah,
You want it to be thin out here, and you want to have a really thick, robust dermis. Okay?
yeah,
And so we also have salicylic acid in there, which is helpful for acne. It kind of brightens the skin. It is a supporting player.
yeah,
Don't give it too much credit because, whenever somebody has acne, you go into the drugstore and everything has salicylic acid. Well, then why do people still have acne?
yeah.
So, it's a supporting player. Now, I want to talk about something that before we go any further in terms of treating rosacea, I want to talk about something that is always kind of a conundrum or it's confusing to people. So generally, if you have rosacea lesions, it's through here. And you might not have rosacea lesions, but what if you have acne? Usually it's going to be on the chin. It could be anywhere, but it could be on the chin and around the jawline. Okay, so you've got both these issues. And you say to yourself, oh my gosh, well, what if I'm trying to treat the acne, but what if it makes the rosacea worse?
Yeah.
And if I'm trying to treat the rosacea, is it going to help the acne? Okay, so number one, whether you have acne or rosacea, it's going to be skincare management.
Yeah.
Okay, now let's just say though that somebody's got some acne and you've got rosacea and you've got the rosacea lesions. So for rosacea, and we won't go into this in a lot of depth, but for rosacea, we would recommend skincare, or for acne, we'd recommend skincare management, and we'd recommend duality. And duality
I love you.
manages acne, and it goes after, and also it has a huge effect on aging. Okay, so we get both at the same time. Now, one of the chambers of duality, so two-chamber product, is benzoyl peroxide. And first of all, this benzoyl peroxide is different. It doesn't dry the skin. Works faster, it works better, it doesn't dry the skin. However, this also is a primary tool for rosacea. And about a year and a half, 2 years ago, they came out with a new prescription drug for rosacea. And by new, you can have something that works for rosacea, but you can't have it as a prescription unless you take it through the FDA and go through all of the testing and everything. So this is something that was approved for rosacea. And guess what it is? Benzoyl peroxide. Now,
Yeah,
you
that's
don't
amazing.
need a prescription for this. So let's just say you have acne using duality. It's also going to help the rosacea. Okay, so you don't have to worry about it having a negative effect. It's going to be amazing for your rosacea. But what for our purposes today, when we're talking about just rosacea, so skincare management, and the second part of this is going to be Rosalieve. Now, Rosalieve is specifically for rosacea. Rosalieve, the primary target for Rosalieve is to downregulate these inflammatory pathways. It downregulates the kisilicidin protein. Okay, there's a special peptide in there that focuses on that, and there's other anti-inflammatories. And so it can be an absolute amazing tool. And again, even if we were able to manage the rosacea, if somebody goes out and goes on a bender or has a lot of sugar, and I know this is really hard, the rosacea is probably going to flare up. And it may not flare up right at that moment. It can, sometimes there's a delayed reaction.
Yeah.
It's 2 or 3 days later. So, but this is, it really manages it. And if we can't get it completely managed, or let's say consistent, so it looks as good as it looks on your best day, then we can add in duality, even if you don't have acne, because one of the things that you do with any of these kinds of disorders is you want to be progressive. And by progressive, you get somebody to a certain point and you say, you know what, I can get you even better and better. It's like a runway. You're going to continue on that runway and take off. And so what we want to do, one way or the other, is we want to get somebody on a retinoid. Duality is the benzoyl peroxide and a retinoid, 2 chambers. But we want to get somebody on a retinoid one way or the other, because retinoids are a gold standard for rosacea. They're gold standard for acne. They're gold standard for aging, and they're gold standard for discoloration. And you can have any of those kinds of things. And if you don't have them now, eventually you probably will. Everybody by the age of 35, if you've got skin, you're going to have abnormal pigmentation.
Yep.
So we can address all those things at once, progressively.
Yeah. We love being able to treat, like it's like multifaceted. We could treat it all together.
Mm-hmm.
And it's hard to choose, can I treat my acne? Can I treat my rosacea? No one says that. They want to treat everything.
So do we have any questions? I can't tell.
No one submitted a question yet.
I had a comment. So I'm an esthetician and work with your products. I also have mild rosacea. Great. Well, thank you. And but I don't see any questions. So guys, ask questions.
Yeah, feel free to ask any questions. No, I'm just scrolling back through here too really quick, because I know people have, I mean, oh, she said I submitted questions. Oh, I don't see it. Hold on one second.
I don't know if we're somehow, looks like my screen is a little stuck or something.
Yeah, I'm going back up here to just see. Okay. Oh, here we go. So they're asking blue and red light for LED for rosacea.
Okay.
Maybe, or either.
So first of all, blue light typically, when it works, is for acne. Red light would be more for, I'm going to say more for aging. Those lights are generally, and again, I'm not saying they're bad things, they can be helpful, but those lights are generally very mild. So in terms of the kinds of results you're going to see and the frequency you're going to have to do them to see results, it's a lot. And unless you're in a physician's office where they have big panels of these lights and they're much stronger, what you're better off doing is something called IPL. That's called intense pulse light. Now, IPL is categorized as a laser, even though it's really a light source. And you would find an IPL machine in any med spa, any dermatologist's office, that kind of thing. And in general, in most states, it's operated by a registered nurse and above, so somebody, so a medical professional. Now, it is not ablative, meaning it doesn't take your skin off. Yeah. What it does is this light source is directed to either red or brown in your skin, so you can get 2 things at once. And it literally kind of disables those blood vessels. So the blood vessels, the appearance of them, they just go away, or they get so much less noticeable. It's not one treatment though. It's usually a series of 3 to 5. They're spaced about 4 to 6 weeks apart. And also, you can treat the entire face. If you want, you can treat your neck and your chest, because a lot of times when people get an aging chest, they look at the brown, but there's also a lot of red in there. And a lot of people say, oh, well, gee, if I use something for discoloration, I'm going to get rid of the red. No, that's vascular. That's also sun exposure. People who have that, it's not even connected necessarily with rosacea at all. So you can go after that at the same time with this device. And it's not that expensive, depending on where you live. I've seen treatments for as low as, for just the face, it's $200 to maybe $300 to $350, somewhere in that range. And once you get to that point at 3 to 5, and you say, wow, I just really like how my skin looks. It looks really even. You have to maintain that. And by maintaining it, it might be for you, you come in once every quarter and have a treatment, or once every 6 months. Something like that. It's not like you're there all the time. And everything that you're going to do at home is going to help to maintain and enhance that. And also what you can do in clinic, because doing peels, glycolic peels, is so helpful for rosacea. Because it's so anti-inflammatory. It's also anti-aging. There's so many things. This is why you want to reach out to Amanda, because she has the tools to really treat this and can really take all of the mystery out of it and come up with a program that's going to actually be a solution.
Yes. And here we love our resurfacing gel exfoliator by Marini. That is like a treatment that I do constantly, and we just like love the results because there's like minimal downtime, and my clients walk out of there very glowy and happy. So,
I noticed there's a question here, and
oh,
this is a great one.
okay.
It says on the website, it says you use Duality 3 times a day. Is this true? So let me explain. It's actually not true. So let me explain. Benzoyl peroxide is an over-the-counter drug. It's regulated by the FDA. So with an over-the-counter drug, even though we have 2 chambers and we have the retinol, you have to put down an instruction from the FDA. Every company, if you look at any company out there in a drugstore, any company, no matter what their product is, it has benzoyl peroxide, this is what they have to put on legally. And legally, what it says is to use 3 times a day. No, you use it once a day.
I get that question actually a lot, and I always tell my clients, no, we're going to do once a day.
Right. Now, if you're a teenager and we're not using Duality, we're using just benzoyl, it's a whole different routine, but it's not, it is, and will we ever come out with body care? We have body care.
Yeah.
Yeah. We have a body scrub, a glycolic body scrub. We also have Body TX, which is amazing. It literally changes your body skin. What would you apply? When would you apply Rosalieve if you're using the kit? Okay, so Rosalieve is what we call an accelerator, and there's different accelerators like Duality or Luminate or retinols or Hyla 3D or any of those things that are accelerators for different concerns. Accelerators are put on in the same spot. So the products are numbered. There's a cleanser, there's a sunscreen, 5 products, so they're numbered 1 through 5. Number 3 is BioClear. Number 4 is going to be a hydrator, transformation or age intervention. And in between the 3 and the 4, we call that 3.5.
Yes.
And that's where your accelerators go. And you might be using more than one accelerator over time. You can use as many accelerators for different solutions and use them at the same time. You don't have to worry about, gee, what order do I put it on? It's a matter of preference.
Yeah.
But just make sure you just put it on. And the only thing that is not put in that 3.5, the only product that's an accelerator is Booster.
Yes.
And that's the only one that goes on before Siesta.
I use Booster and I love it also.
Okay. What would you recommend for visible pores in the T-zone? Okay. Now, let me talk about pores. So most of the time, the reason that you have pores that look larger and visible is because you have retentive matter. So your pore is like, it, when you look at it, it's a long hollow tube. It's about as big around as the diameter of a hair. And clogged follicles or retentive matter in the follicles is a very mild form of acne. It's the mildest form, but it's still acne. And so what happens is as the cells stick together, the beginning of the process, and they stick together and they stick together, they cause the follicle to dilate. It looks expanded, so it's more noticeable. And, you know, if you've ever gone in and had extractions done, which are very helpful, but extractions on their own, like extracting blackheads, you remove something, but you're really only removing something from the opening of the follicle. You're not stopping that process. So what we have to do is we have to constantly manage that process. And when you use the skincare management system, the cleanser has glycolic in it, and BioClear has glycolic in it. Now, glycolic is a very tiny molecule. Guys, you may think you're using the best cleanser in the world. You may love your cleanser. The molecules are too large to get into your follicle. And the reason you clean your skin is not just to remove makeup, it's to have follicular cleansing so that you don't have acne and your follicles are nice. When you get rid of the retentive matter, they relax. Now, they're not trap doors. You can't open and you can't close them, but you can make them look like they're closed. Again, I'm a 2-time Accutane failure. Do you see any
Not.
follicles? You don't see anything. Okay. So glycolic acid has such a tiny little molecule of anything out there.
Yeah.
It's even used as a drug delivery system in certain topical prescription products. So it goes in and it dissolves and dislodges the glue-like substance or cellular cement between those cells sticking together. So not only does it literally, within a day or two, you notice a difference, a major difference in the look of your follicles, but it also helps interrupt the acne process. Now, BioClear even furthers that, even does it even further. And also just the appearance of fine lines and wrinkles and texture, all of that is dramatically transformed. If you have acne as well, you need to throw Duality into that mix. So you need to be using the skincare management system and Duality. If you also have actual acne where you're getting lesions. And acne, you know, I hear this all the time. Oh, I don't have acne. I just break out once in a while. I don't care if you break out once a year, 5 times a day, once a month. It's all acne. If you take your skin and you touch and you can feel bumps, that's acne.
Yeah.
And if you actually have a breakout, that's acne. So with the skincare management system, lots of times that's completely managed. But we might need to take it a step further with Duality. So that's really going to be your primary remedy for pores. And retinol, which we would want to add in because it's so dramatically effective for aging and so many things, that also is going to make a difference in pores. Because here's the second reason why we have larger pores. Okay, so I said it's a long hollow tube, right? Now, your pores are surrounded by your dermis by collagen. 80%. Dermis is 80% collagen. So your dermis acts like Spanx around that follicle, keeps it nice and firm and tight. Well, what happens is you hit the age of 20 and your dermis begins to thin. You lose about 1 to 2% a year, and then it starts going up, and it can be more depending on how much sun damage have you had.
Yeah.
What's your lifestyle? How do you take care of your skin? All those kinds of things can make a difference. Now, you hit between the ages of 37 and 39 is perimenopause. You lose more collagen. And then between perimenopause and menopause, which is around 49 to 51, when you hit menopause, you start losing a lot more. And within the first 3 to 5 years, you use another 30%. So you're going at about 5% a year, 30%. And not only does that make your pore size look larger, your skin looks like it's collapsing, but after menopause, women, in terms of facial aging, age twice as fast as men.
I don't like that.
Glycolic thickens the dermis 33%. Retinoid, the right retinoid, you can thicken the dermis about 50%, and more recent studies have shown a year of use, 80%.
That's
That makes a huge difference in your pores. So you really need to kind of, that again, it's very systematic. This is about solutions. I never put anything on my face unless I know it's going to have a specific solution and there's some type of data to validate it. You know,
yeah.
it's about solutions. You don't want to put something on your face just because it feels good.
No.
You want to address your rosacea or your pore size or your acne or your fine lines and wrinkles, your textural changes. Everybody has those concerns. What's the percentage of retinol in duality? So in duality, you're getting roughly about 0.5%. And in
Okay.
duality MD, it's more like 1%.
Okay. That's
Okay.
good. Good amount.
And oh God. It's Hyla 3D cream and moisturizer is best used with a moisturizer. Use it with a moisturizer. Now, technically, is it a moisturizer? Yes and no, but you kind of want to seal it in. So
Yeah.
Hyla 3D is a volumizer. One of the primary aspects of aging, the aging face, is about 50% of what we perceive as aging is a loss of volume.
Yeah.
So there's something called the youthful triangle. Put a triangle over your face. This should be the highest, widest part of your face, and it should narrow down into well-defined jawline. And actually, ideally, you want a heart-shaped face, right? Now, what happens as we age, and this is not just volume. Volume would be hyaluronic acid, mucopolysaccharides, ceramides, phospholipids. They're known as GAGs,
Yeah.
glycosaminoglycans. Okay, and between your cells, and they give your skin volume and barrier function and make it nice and soft and radiant and moist. Okay, so you lose those substances, but you also lose fat, and there's muscle in there too. Now that pulls down. But what happens is as you lose volume, then literally the face kind of starts to swing forward like a pendulum. So this area goes down and it becomes flatter.
Okay.
And eventually, as that continues and you see a nasolabial fold, you can turn the triangle upside down. And this will be wider than this. And also, when it moves down, it comes to a hard stop at the pre-jowl area, which is in here, because it can't go further than that. So what happens, you get jowling.
Yep. Yeah.
Now,
Because I'll see people
when we can increase volumization, and this is a very unique hyaluronic acid. This is not your hyaluronic acid that you see in the marketplace. This is very different.
Mhm.
Then we actually, it has to do with being able to increase collagen, and it has to do with helping with volumization. Now, it doesn't replace injectables, but it can make a definite difference. And you use it in the system in that 3.5. So between BioClear, it's an accelerator, and between your hydrator. It doesn't cannibalize anything in the system. Nothing cannibalizes the system.
No.
You don't say, I'm going to use this, so I'll stop using that. The system is the system. That's the base point. That's like brushing your teeth. If you want to use a mouthwash, great. If you want to chew some kind of gum that, you know, does something for your plaque and freshens your breath, great. But you don't stop brushing your teeth.
I know I always get the question, like once people are starting to clear or seeing major improvements in the rosacea, the number one question is always, well, like how long do I have to do this for? And I'm always just like, well, how long do you want to look good for?
Yeah. There's no cure for these things, unfortunately. And can duality be used daytime for acne, rosacea to prevent flares? First of all, can you technically, if you absolutely have to? Yes. But the majority of people, we get management, we get complete total clearing just using it in the PM, because it has to do with downregulating those inflammatory kinds of things. And also it has to do with keeping the C. acne bacteria at bacteria static levels, meaning we kill it off, but it's part of your body, so you can't kill it forever. You have to kill it every 24 hours. So in general, but again, teenagers, it's a little different. And individuals can be slightly different, but usually with duality, it's once a day. Teenagers, when we do just benzoyl peroxide and benzoyl peroxide wash for teenagers, then sometimes it's going to be twice a day for the benzoyl peroxide. It just depends.
Um,
Um, Go ahead.
oh, okay. So what would you say? So in the past, like clearing acne, I've had a lot of there's always a question about like vitamin C pairing with acne. And like since starting everyone on the skincare management system, like I have really no issues with siesta when working
Yeah.
that into an
So tell me, what do you think their concerns are? If I said to one of your patients, and I said, well, so what is your concern about pairing vitamin C if you have acne? What would they say?
I think that they think it's going to be too harsh or
Mhm.
it's going to be that like citric acid, like is there going to be irritation? But usually I just now I tell them that we're using L-ascorbic acid and we're not using like this is like fat soluble versus like water soluble.
Right. So, so they're absolutely right. When you're using ascorbic acid, which is most of the vitamin C products are ascorbic acid, you are at a pH in order for it to work really effectively at 2.5 or lower, which is really low. Now, even if you didn't have acne, that can cause inflammation and irritation for about 50% of the population. If you have acne, that inflammation can sometimes kind of aggravate things. And there could be other things in the product also, which could be comedogenic. That's the main thing. You don't want comedogenicity or acnegenicity. So with lipid soluble C, number one, it is a neutral pH. Number two, there are studies that actually show that it decreases inflammation, pustule and papule count. It actually decreases it. There's studies been done on acne. And I could spend an hour talking about all the studies. And if you go on Medline, there's probably 1,500 or more studies on lipid soluble C. And it's more effective than ascorbic acid. And you can
Oh,
use it at the same time that you're using a retinoid and glycolic. You don't have to separate
yeah.
them. And so I could go on and on, but absolutely, you want to know that it's going to make that acne actually assist in the appearance of making it look better. Um, is it true your skin will purge when you start to use the system? Okay, so if you have a tendency to acne, I'm going to tell you what generally happens. And I'm sure, Amanda, you can chime in anytime you want. But lots of times, what will happen is people will say, wow, I noticed that my skin looks calmer. I don't seem to be having as many breakouts. So that kind of happens right away.
Yeah.
And my existing breakouts seem to be going way faster. Then they might say, but I'm getting a few new ones.
Yeah.
Now, you probably get new ones anyway. And so anytime you have retentive matter in the follicle, it has to go somewhere. Some people don't see additional breakouts. Some people do see a few additional breakouts, but at the same time, they notice that their skin is looking better, meaning less red, pore size is much more refined, existing lesions going away faster. Now,
Oh, the sound just cut out. Hold on. Can I? Oh, I don't know if it's on my
can
end.
you hear me?
Oh,
No, it might be on mine. Can you hear me now?
yeah.
Okay. So typically, if you have somebody that has more persistent acne, we might start them pretty quickly on duality.
Yeah.
In general, if we think we really need duality, and a lot of acne patients are going to need duality, we usually give it 2 weeks to get adjusted to the system, acclimated, and then we add duality in. If somebody had more moderate severe acne, though, I'd say, you know what? We're going to do duality with the system right away because it overrides maybe if you have a slight bit of redness or something. If your acne is just like going away right away, then that kind of overrides. And I'm sure that everybody would agree with me. Yeah, if my acne goes away right away and I have a slight bit of flaking or something, I don't care. Um, so but generally, that so-called purging is not an issue. And let me tell you something. One of the things that really irritates me is when somebody says, "Oh, I bought these skincare products and they really made me break out, but I keep being told that I'm just supposed to purge."
Yeah.
Well, how long have you been using them? Well, 2 months, and it's just making your acne worse. You
Yeah.
shouldn't have to go through that.
Sometimes I've seen purging where the most
Oh, we
I ever
and if you have something, if you're on our system in duality, and for some reason your acne is just not responding, there could be some other
Yeah.
factors. Sometimes birth control is a factor, particularly if you've got pellets under the arm. Sometimes there can be other things which are hormonal interactions and things like that, but that's something that all that can be addressed.
Yeah. Circle back to purging. When people come in for their facial, if they have, like, the most I really see is if they're severely non-inflamed and they have like a
Oh,
lot of non.
the closed comedonal acne.
Yeah. And I'll go in and extract as much of that as I possibly can, like during their facial. Sometimes I'll spend the whole facial doing that. And then um usually kind of like help kick it off, and then we'll go in from there. And I've seen such fast results with a lot of people with the comedonal acne.
Mm-hmm.
And because it just like that retinol plus that BPO combo, I mean, knocks it right out.
Well, Amanda, I'm so glad you brought that up because here's the rule. Here's kind of a little bit of a difference. So that sort of non-red, non-pustular closed comedonal acne. So you've got these bumps underneath the skin, and they're kind of hard. I like to say that's almost like cement. And
Yeah.
those really do need to be extracted. I'm not going to say over time that it doesn't get better, but they need to be extracted because once you extract them, then your skin is really responds tremendously. And that's another reason why you want to work with Amanda.
Mhm.
And the other thing that you can do, there are things that we can do to speed up the process and also just continue to refine the skin. For example, we make the Marini exfoliating clear pads.
Yes, love those.
Oh my gosh, for discoloration, acne discoloration. Now we have things in the duality that get rid of that discoloration about 300 times faster. It's not a scar, it's discoloration. A scar is an injury to the dermis, that's different. But the pads also, pore size, just making the skin look younger, smoother, much more refined, and it gets rid of the discoloration so fast. So there's things that you can do in addition at home to speed up the process and just refine it even further.
Yeah. I mean, I'm like those clear pads don't leave my bathroom. If I run out, I'm already robbing my work for more before I run out because
And they're good for rosacea.
yes, they really are. I mean, they're just incredible. Okay,
Well,
so
I think I think that's probably, I can't see any other questions.
let me see. I think that was okay. We already answered that one. Okay, what should you do with redness that's left? Okay, we basically just talked about that after your acne clears.
Okay,
Um,
so here's the good news. If you've got fair skin, here's what happens. Okay, so you have all this retentive matter in your follicle, and you have C. acne bacteria, and you've got dead cells and oil, and the oil eats the bacteria and it excretes a fatty acid byproduct, and that wears down follicle wall. So what happens is eventually your follicle either leaks, ruptures, or blows out. And that means material goes outside the follicle, and it's an inflammatory process, and it's kind of like a foreign invader, so your body just wants to get rid of it. And what it does is it makes its way to the surface. As it makes its way up there, it disturbs little blood vessels. Now these blood vessels get leaky, and they leak out the color of the blood, which is bilirubin, bilirubin, etc. And if you have fair skin, the good news is probably going to be red. We can get rid of that really fast. If you have more pigment in your skin, it's going to tend to be darker. So it could be brownish, purplish, even blackish. And we have something that gets rid of that, again, about 300 times faster in duality. Glycolic gets rid of it a lot faster. Everything we do gets rid of it faster. But the peel pads are really, really significantly helpful with that. And it's just being consistent. Let me tell you guys, if I miss a day doing my duality, doing my program, I'm going to break out. I might not break out right away, but within a few days, I'll break out. Or I could break out the next day. So you have to be really consistent. And the more consistent you are, the more you can address the discoloration and all those kinds of issues.
yeah, I know. I'll break out immediately. And I mean, I'll change my pillowcases frequently. Like I just can't miss my Okay.
Okay. Well, I cannot wait to come back for our
Thank-
next one.
yeah, thank
And
you so much. I
great
really,
questions. Thank you, everybody. And thank you so much because I wouldn't be here without you. And yeah, it was your audience had great
yeah,
questions.
that was awesome. I was like, oh no, nobody has questions, but well, I really, really appreciate you taking the
Oh,
time to
my pleasure.
answer all this. You're just a wealth of knowledge, and we appreciate you.
Thank
And yeah,
you.
we'll do another one of these.
Absolutely. Well, until next time, thank you so much. Bye.
Bye. Thank you.